Hello, my name is Sandra Herrera, and I'm doing a case study presentation. The case that I chose was case study number 15. In this case study, there is a patient named Marcel Klinger, who is a 60-year-old registered nurse. She is one of 7 employed by her small community hospital. The entire facility only has 32 beds, and although there's other nursing aides and licensed practical nurses to assist, state law requires that a registered nurse always be present in the facility. When the nurse who had worked a graveyard shift, 11 to 7:30 a.m., finally retired, the hospital administrator asked for a volunteer to fill that position. Nobody did, so the administration decided that it was only fair that everyone takes turns. The result was 4-week shifts. In the course of a year, each nurse would work 6 of these shifts on days, 4 on evenings, and 2 on graveyard. The switch from days to evenings wasn't too bad on Marcel. She lived close by, so she could be home in bed by midnight, but the graveyard shift was a disaster. She explains how she felt that as being the only registered nurse there, she was supposed to be awake and alert the whole time. Patients were dependent on her, but her eyes kept squeezing themselves shut, and her brain seems to hum as if going to sleep. Part of the time, she feels sick to her stomach. One time, she did fall asleep at work, just for 10 minutes or so, she describes. When the phone rang, she woke up feeling hungover. Marcel's physical and mental health was excellent. She'd always been a light sleeper, so she found daytime sleeping nearly impossible. Heavy drapes could keep out most of the light, but traffic noise and the sounds from passerby on the sidewalk outside her bedroom frequently awakened her. Moreover, the coffee Marcel drank to keep awake at work prevented her from going to sleep as soon as she went to bed. It also got her up to the bathroom at least once or twice. By the time her husband came home in the afternoon from teaching school, she had seldom slept more than 3 or 4 hours. On weekends, she tried to resume a normal schedule so that she could be with her family, but that only made things worse. She flew to Paris once, she described, and felt jet lagged for a week. Now she's sick that way for a whole month. Based on the case presentation, I decided that she had shift work sleep disorder, or SWSD, which is a circadian rhythm sleep disorder characterized by insomnia and excessive sleepiness affecting people whose work hours overlap with the typical sleep period. According to literature review, shift work sleep disorder is a chronic condition. The symptoms often impact everyday life. Some of these symptoms include excessive sleepiness, both on and off the job, difficulty concentrating, lack of energy, insomnia that prevents you from getting adequate sleep, sleep that feels incomplete or not refreshing, depression or moodiness, and trouble with relationships. Chronic sleep deprivation can be dangerous and can increase the risk of falling asleep at the wheel or making errors on the job. It can impact your life, your health, including heart health and proper digestive function. It can also increase the risk of cancer. Older workers and female workers are at risk for higher levels of sleep deprivation with this condition. Diagnostic criteria according to the DSM-5 for circadian rhythm sleep-wake disorders include a persistent or recurrent pattern of sleep disruption that is primarily due to an alteration of the circadian system or to a misalignment between the endogenous circadian rhythm and the sleep-wake schedule required by an individual's physical environment or social or professional schedule. B, the sleep disruption leads to excessive sleepiness or insomnia or both. C, the sleep disturbance causes clinically significant distress or impairment in social, occupational, and other important areas of functioning. Furthermore, with shift work type, insomnia during the major sleep period and or excessive sleepiness, including inadvertent sleep during the major wake period, associated with a shift work schedule, or i.e. requiring unconventional work hours like Marcel has. The non-traditional work schedule can disrupt a person's circadian rhythm or biological clock. It regulates wakefulness and sleepiness and relatively set times throughout the 24-hour day. The circadian rhythm can have frustrating symptoms when it's been thrown off, since it affects sleepiness, alertness, body temperature, hormone levels, and hunger. It is estimated that 10 to 40% of shift workers experience shift work sleep disorder. Those who have regularly shifting schedules are most likely to be affected. So for my rationale for my diagnosis of shift work type, according to literature review, diagnosis is primarily based on a history of the individual working outside of the normal 8 a.m. to 6 p.m. daytime window, particularly at night, on a regularly scheduled, i.e. non-overtime basis, like Marcel. It occurs in individuals who work non-traditional hours like split shift, graveyard shift, early morning shift, or rotating shifts, just as Marcel. Symptoms of excessive sleepiness at work and impaired sleep at home on a persistent basis are prominent. Presence of both sets of symptoms are usually required for a diagnosis of shift work type. Marcel had mentioned how at home she was unable to sleep. These symptoms can affect both work and leisure time. She had mentioned also that she was trying to maintain a normal schedule on the weekends so she could be with her family, but that only made things worse. And typically when the individual reverts to a daily work routine, symptoms resolve, just as Marcel mentioned in the case study. While many employees are unable to change their work hours, there are ways to lessen the effects of SWSD. There are many lifestyle changes you can make which can relieve some of your sleep disorder symptoms. Some of these recommendations include trying to keep a regular sleep schedule, including on days off. If possible, take 48 hours off after a series of shifts. Wear sunglasses when leaving work to minimize sun exposure. Doing so can help prevent the daytime clock from activating. Taking naps when possible. Limiting caffeine intake 4 hours before bedtime. Maintaining a healthy diet rich in fruits and vegetables. Using heavy shades for sleeping to create a dark environment. And asking live-in family members to reduce noise by using headphones to watch TV or listen to music, and asking them to avoid chores until the patient is awake. Avoiding a long commute if they can. It can cut into the sleeping hours and cause further drowsiness. Keeping nightly rituals before bed, even during the daytime. Wearing earplugs or using white noise to drown out sound while asleep. Purchasing a light box for light therapy to expose the eyes to extremely bright light but safe light before work. And taking a 30 to 60 minute nap right before the shift. While lifestyle changes are the most important components of healthy sleep, some may turn to sleep aids. Melatonin is considered safe, and some research suggests that melatonin might improve daytime sleep quality and duration in people whose jobs require them to work outside the traditional morning to evening schedule. With exogenous melatonin, 1 to 3 milligrams taking 30 minutes prior to the desired sleep time is the recommended dosage. Side effects may include headache, dizziness, nausea, and drowsiness. Hypnotics such as short-acting non-benzodiazepines like zolpidem and short or intermediate-acting benzodiazepines like triazolam and temazepam are other options, especially for patients who have difficulty initiating daytime sleep at the desired time despite optimal sleep hygiene. Hypnotics can be used to promote daytime sleep. Limited studies in shift workers have demonstrated improvements of 30 to 60 minutes in daytime sleep with use of hypnotics. However, hypnotics may not eliminate excessive sleepiness, and patients are at risk of carryover sedation effects into the night shift. A third treatment could be wake-promoting agents like modafinil and armodafinil. There is moderate quality evidence that wake-promoting agents improve alertness during shift work. 150 milligrams of armodafinil or 200 milligrams of modafinil 30 to 60 minutes before the night shift is the recommended dosage. Side effects include headache and nausea. This concludes my case study for number 15, Marcel. And based on my research and the case study presentation, I have concluded that she had circadian rhythm sleep-wake disorder, specifically shift work sleep disorder. Thank you for your time.